everyone, and welcome to this webinar, Unsinkable, How to Build a Resilient Workforce and Help Your Employees Thrive. I'm Lynn Gresham with EBN, your host. Today, we're excited to be joined by three HR experts, each of whom has a wealth of experience in building healthy and engaging company cultures. I'd like to introduce them to you now. Leah Dunn is the Director of People Operations at Lucid Software, whose product suite helps teams see and build the future through visual collaboration. Leah currently manages Lucid's global benefits program, focusing on helping employees feel empowered to use their benefits through comprehensive education and communication initiatives. Eric Snow is an area vice president at Gallagher and has been consulting with employers on employee benefit strategies for 11 years. Eric's areas of expertise include total reward strategy, employee well-being, cost containment strategy, financial analysis, vendor management, and compliance consulting. He holds a Certified Employee Benefit Specialist designation from the International Foundation of Employee Benefit Plans and the Wharton School of the University of Pennsylvania. He's also received a Certified Health Rosetta Advisor designation. Dallin Allred is a serial entrepreneur and angel investor. He has co-founded several successful companies in different industries. He's currently the co-founder and CEO of Tava Health, a provider of innovative mental health benefits with a mission to increase access to mental health care for all. Today, Leah, Eric, and Dallin are going to discuss employers' role in supporting employees with today's challenges, effective strategies that strengthen engagement and healthy culture, and finally, the impact of mental health support in the workplace. Time permitting, they're going to answer your questions. So now let's begin. Panelists, the first question I'd like to put to you is, what are the biggest challenges faced by employees in today's workplace? And what should the role of company culture in helping employees face these challenges be? Leah, I'd like to start with you.
Yeah, I think, one of the biggest challenges that employees have is really just all of the varying responsibilities that they have, both personally, professionally, lots of varying needs and desires that employees have, either growing their career, maintaining it, lots of different time constraints on them. And it's always a really tough balance for employees to prioritize all the different things taking up their time. So as an employer, I think, one of the most important things you can do for your employees is really evaluate their needs regularly, making sure that you're creating a culture that is receptive to changing needs, a diverse workforce, and changing priorities over time, both on the business perspective and how that relates back to your employees, and taking action when you do identify areas of opportunity. Overall, that's going to help the business success, whether that's maintaining market share, growing it, developing your employees, really through respecting the challenges that your employees face and doing what you can to address those with your benefits programs, your pathways to career progression, anything like that is going to be critical.
Thank you, Leah. Eric, what are your thoughts?
Yeah, first off, great thoughts, Leah. And I think some of what I have to share, I think overlaps as well. Starting mid-2020, the firm I work for began conducting some quarterly employer pulse surveys across the country just to gather data on these questions. What are the people challenges that are impacting organizations? What are organizations doing to address some of those challenges? And one of the questions that we consistently ask in each pulse survey is, what is the top people concern for leadership at your organization? And as you can imagine, through the shakeup of 2020 and beyond, the answers to those top 10 most commonly cited people concerns changed a bit in priority from quarter to quarter. However, a pattern emerged over time highlighting three concerns, and they were in this order. Number one, employee burnout. Number two, employee well-being. And number three, training and development and managerial effectiveness. I think all of these are really interconnected. And some of them are just a reflection of the world that we live in today. On a personal note, I'm about halfway through reading a book, which was long overdue, by Jarian Lanier, the tech guru, titled 10 Arguments for Deleting Your Social Media Accounts Right Now. And I'm halfway through, and I'm convinced I probably need to move forward. And my point is the root cause of some of these symptoms are outside an employer's control in some sense, but company culture can definitely play a role in supporting employees that are facing these challenges. And our team has observed that specifically a company culture that provides interpersonal support to employees can help reduce employee burnout and overall improve employee well-being.
Thank you. Dallin. Dallin, I think you're muted.
Thank you. Yeah, I was just saying, well said to Leah and to Eric. I agree with everything that they said, and I think one of the other unique challenges post-COVID for employees is a bit of a dilemma of choice, and more specifically, it's do I stay with my current employer? Do I look for greener pastures? Do I quiet quit? They have more optionality than ever before. There are different employee structures, different geographies. They can move to a remote or a hybrid role if that's a better fit for their preferred lifestyle. And so on the other side of that coin, the challenge for employers that are trying to set a winning culture is one around retention and the potential cost of higher recruiting and employee churn. I think what both Leah and Eric called out around employee measurement, pulse surveys, engagement surveys are spot on. I think the only thing that I might be able to add to it would be the importance of being transparent about the results of those pulse surveys, calling out, especially if you're in a manager or a leadership role where there are areas for improvement, and then making those changes so you can demonstrate that you are listening and taking the feedback as a leader.
Thank you. Well, speaking of polls, we'd now like to give our audience a chance to chime in on the discussion with our first polling question. Please give me your answer to which of the following most strongly creates positive workplace culture? Would it be leadership, compensation, work-life balance, or opportunities for advancement? Which most strongly creates positive workplace culture? We've got a large group with us today, so I'm going to give it some time for the results to populate. I'm going to ask each of you panelists to comment on the results when they come in. Okay, I think we can probably close the poll now and take a look at our results. Leadership logged 55% of the votes, followed by work-life balance at 40%, and compensation and opportunity for advancement came in way behind those two. So, Leah, what do you think about those results?
Yeah, this actually doesn't surprise me at all. I think that there's a lot to be said for work-life balance and solid leadership at a company that ties into just how the company overall is being managed and run. And that ties into so many other factors as far as creating an equitable compensation structure, as well as opportunities for advancements in the company itself. And that's due to really having the foundations built to be successful as a company from the employee management perspective that really tied back into leadership and work-life balance from the beginning. So I think that is very much in line with exactly the results that I expected to see.
Eric, Dallin, do you have anything you'd like to say?
Yeah, I'd add, maybe then Dallin, please add as well. I think this pulse survey reflects what we see in our research, but also my own personal experience. As I think of organizations I've worked for, where I've felt we've had a really good culture, a lot of that's been driven by leadership. Alternatively, this is a little different question, but I thought I'd point this out as well. Note, how low compensation was on the responses here. LinkedIn conducted a big survey several years ago where they had asked employees by generation what were the most salient factors in leading them to look for another job. And with one exception, just about every generation, it was comp and benefits. So it's interesting. Again, a different question: why would you leave versus that positive employee culture? But I think worth considering that as well in light of this question.
Thank you.
Yeah. And I might similarly take one of the responses from this work-life balance and again turn the page to the other side and say that might be considered kind of the inverse of burnout. One of the reasons we decided to start our company here at Tava and focus on mental health was to help alleviate some of the challenges and concerns that employers were experiencing around burnout, and specifically to make access to clinical mental health care a bit more normal. It's really interesting that the amount of stigma that surrounds mental health isn't present in other parts of healthcare. For instance, if I go to the dentist, no one feels stigmatized or judged by saying, I'm going to the dentist to get my teeth cleaned. And unfortunately, that stigma does kind of stick with mental health currently. And I think the way we pull that down and the way we resolve some of those concerns around burnout and subsequently culture are improving access to mental health benefits and mental health care, and encouraging team members to use it in any form that they can.
Well, let's talk about creating a great culture. Leah, on the Great Places to Work website, just over half of all employees report that their company is a great place to work. For Lucid, the percentage is 96%. To what do you attribute the difference between Lucid and other employers?
Yeah, I mean, I can't say for certain what other employers are doing necessarily, but this is very much a source of pride and accomplishment for us here at Lucid. And really, I drive it back to us taking a lot of care and making a lot of effort to really listen to our employees. So, I mean, Dallin and Eric both touched on it earlier too, the effort of surveying employees and then not only looking at the feedback, but taking action upon that. And whether that's through leadership initiatives or just overall company policy change, or really trying to, at the end of the day, influence company culture, can be a really difficult challenge to overcome. But at Lucid, we've always had that sort of mindset where we're very transparent in what we're trying to accomplish with employees, and we take great care in making sure that we're meeting objectives both on the business perspective as well as what makes sense for our employees. It's in fact through a lot of these survey efforts that we first identified the need for an expanded mental health benefit, which kind of got our ball rolling with Tava in looking at adding that service to our employee benefits package. So it's really through, taking action upon the employee feedback that, has been reflected in our employees' external survey results too, such as with the Great Places to Work, that, Lucid is a great place because we are prioritizing our employees' needs with business needs as well. And ultimately that makes us successful in the market that we are in. So we're really pleased with that stat, and really would encourage other employers to not just look at what your employees are asking for, but figure out why are they asking for it and what can actually accomplish the root cause of it. There's a lot of analysis that goes into that, but it can be really valuable in having lasting impact and lasting change at the company.
Thank you. Eric, as an insurance and benefits consultant, you've talked with many HR and people operations teams. What investments do you see paying off as companies try to support their employees?
It's a great question, and if you don't mind, I'll just add on to what Leah had mentioned. I have been lucky enough to have some insight into Leah's work at Lucid and Lucid's teamwork, and I've always been impressed with how people-centric their approach is in terms of planning. So what Leah shared is definitely not lip service by any means. In terms of answering that question, what investments pay off as companies try to support their employees? I think it's a great question because all too often I'm having conversation and our team is having conversations with employers who are spending a lot of money on their people, but have reason to believe that their approach is inefficient. And by inefficient, I mean that the total investment in terms of dollars might be sufficient, but it's not directed in those areas that will ultimately move the needle. So to identify ways to improve efficiencies in an organization's people investments, there are a few different ways to go about that. We always recommend conducting a scientific based employee engagement survey backed by a normative database that can make sense of the responses you get. And that's very different than throwing kind of a list of employee satisfaction survey questions together and sending it out. And I feel that's definitely a worthwhile investment. The key employee engagement levers are going to be a little different for each organization, but as we consider what investments might pay off in addressing those top people challenges that we cited a little bit earlier, the data give us some insight. One, the data shows that resiliency decreases employee burnout. So you might be asking yourself, well, as an employer, what can we do, if anything, to increase resiliency or to build that trait within our people? Resiliency can be created by meaningful recognition and interpersonal support. And the data supports that claim pretty strongly. A recent HBR article noted that the single most powerful prediction of human resilience is interpersonal support. So we feel that investments that can create a culture of recognition, including leadership training to help managers understand that relationship, as well as investment resources that provide interpersonal support. Think tools like mental health benefits, like our host Tava offers, are definitely worthwhile investments.
Thank you. Dallin, as a leader and entrepreneur, you've had the opportunity to build several teams from the ground up. Most recently, you co-founded Tava Health as a provider of mental health benefits. What impact to the workplace did you hope Tava could provide?
Yeah, I think I'll call back one of our internal mantras here at Tava, and that's to make mental health as normal as dental health or other types of healthcare. Make therapy specifically more normal. And the two primary challenges to that are around access, affordability, and the difficulty in navigating what's already a very complicated system. And it's made even more complicated sometimes by the challenge you're hoping to address, things like anxiety, depression, burnout, motivation, those sorts of things. So more specifically, we wanted to address the access challenge by making a model that was very easy for employees to navigate, one that would give them continuity of benefits so that they're not confused about where they should start their mental health journey. There's kind of one door to go through. We have a little bit of a challenge in the US system right now where we have lots of different point solutions, and many of them offer mental health benefit as one of their ancillary starting places. We wanted to make it really obvious and easy where you could start and find a therapist if you're looking for a therapist at Tava. Similarly, we wanted to make it easy for all types of employers to deploy those types of benefits, specifically a kind of a next generation mental health offering, maybe a successor to an EAP or an enhanced employee assistance program. But at the same time, realizing that different employers have different budgetary realities. And so we would need to be a little bit creative about how we would structure that to meet each employer where they stood from a budgetary reality standpoint.
Thank you. Leah, what role has employee mental health played in the culture at Lucid?
Yeah, I mean, mental health is a top consideration here at Lucid. I mean, being in tech, as Eric alluded to earlier, it doesn't matter the industry, but specifically in tech, there is a high rate of burnout. Specifically, work-life balance can be very challenging in our industry, and we've seen that at Lucid, as many other employers have. So we've really structured how we look at interactions that employees are having with each other, with their managers, the benefits that we offer, our policies that we put in place to really prioritize employees' mental health within those confines there, and really make sure that this is something that we kind of live and breathe with in our culture, to make sure that people know that mental health is just like, as Dallin has mentioned, taking care of any other aspect of a person's health. So, we do a lot of training around, developing our managers, making sure that they're equipped to talk to their team members, not just on the day-to-day work that everybody's doing, but really on those interpersonal interactions. How are people's mental health status or states, at any given moment? What can, be done, if anything, in the day-to-day work a person's doing if their mental health is suffering. We have our leaders showing by example the importance of taking days off, even if it's just for kind of a mental health day, making sure that people are logging PTO and showing that as an example of this is how you can avoid a lot of those very common mental health challenges that people face due to work, or in conjunction with work stress or work anxiety that we all face. So overall, we've taken a very proactive approach of having a wellness program that talks about mental health. We're in the middle of our Mental Health Awareness Month right now, structuring our benefits. But overall, the most important thing that we do here at Lucid to keep mental health as a priority is talk about it regularly. It's talked about as the department level, our company town halls, even down to those one-on-one interactions between managers and their direct reports or employees with each other, to really destigmatize mental health needs that people have and make that an area that everybody can support each other through in the workplace here at Lucid.
That's terrific. Thank you. Now we're going to have another couple audience polls to bring you back into the discussion. What is your best guess? What percentage of employees at your company are currently struggling with mental health? Would it be 5 to 10%, 10 to 20%, 20 to 40%, or more than 40%? What percentage of employees are currently struggling with mental health issues? Okay, let's take a look at our poll results for this one. 40% said 20 to 40%, and that was closely followed by 40% or more, and then 10 to 20, and only 11% chose 5 to 10%. Panelists, how right are our guesses in this sphere?
I think we must have a pretty informed audience, because I think these survey responses align with a lot of both surveys that are relying on observational data and survey responses, as well as other more actuarial type estimators that include things like medical claims or uptake and utilization of different types of point solution programs.
I'd add, Dallin, our firm, as part of these poll surveys we've been conducting for the last several years with employers, a little different of a question, but we've asked employers what their gauge is on whether emotional well-being is improving, is staying static, or declining among their employees. And the results have been sobering. At best, at any given quarter, there might be 20% of respondents saying they felt like employing emotional well-being has improved, with the majority saying either we feel like it's static or it's declining. Definitely highlights the need.
Yeah, and maybe just following on with that, Eric, I know there are quite a few studies that are also similarly a little bit sobering, unfortunately, of college students on college campuses. And the self-reported rate rates of mental health challenges for Generation Z are almost double what it is for the typical average age working adult in the US. And so it doesn't seem like this problem is going to be resolving itself. In fact, it seems like the urgency will be increasing with the new generation entering the workforce.
You did mention destigmatizing. Are we getting better at destigmatizing, do you think?
Speaking for myself, I hope so. I think we are. I'm seeing more and more anecdotal evidence that we're more open and transparent about talking about mental health, talking about the way we're coping with mental health. Mindfulness is very much a top of mind topic in a lot of human resource circles that I'm a part of. And we're also seeing employers that are making great strides in making investments and improvements to solving the access and navigation challenges. So overall, I'm pretty optimistic that the stigma will be less of the anchor that has held us making progress on this point back. And instead, it'll be challenges we need to overcome around, again, access and navigation.
Thank you. Let's move on to our final polling question. We appreciate your responses. What percentage of employees use their employee assistance program to find mental health care? Please choose between the four options: 0 to 5%, 5 to 15%, 15 to 30%, or more than 30%. How many of your employees use an EAP? Let's give it a few more seconds to tally. Okay, let's take a look at these results. 47% said 0 to 5%, followed by 39% at 5 to 15%. Only 11% chose 15 to 30, and more than 30% came in at 3%. Eric, would you like to give us your thoughts on those results?
Yeah, again, I think our audience has a pretty good pulse here. As we've looked at data with EAP utilization, it's always been well less than 5%, something in more in the 1 to 3% range. And of course, there's certain organizations that may get better utilization depending on communication, culture, etc. But unfortunately, we find that EAPs are far underutilized, especially when we put this in contrast to the need that we've been discussing.
Dallin?
Yeah, I would say the same thing. I think this kind of, again, highlights the gap between need and the ability for those to access the kind of care that they're hoping or needing to access.
Okay, thanks so much.
I would just add on to that too, if I can, really quick, Lynn.
Oh, sorry, Leah. Sure.
No, you're good. Like, the traditional EAP program is designed to really focus on someone when they're in like a crisis situation or they're dealing with a specific challenge. And as you know, like our overall culture has changed, that you know, mental health is not just a one-off instance. It's not like you break your leg and you get treatment for it. Mental health is not you know, suffer from some kind of mental health challenge and you get treatment in just that moment. It has really transitioned into being so much more robust than that, truly a form of preventive care. So, you know, as people have recognized that need for ongoing mental health care check-in, even when it's nothing, you know, specifically wrong in any given moment, the traditional EAP just really doesn't accommodate that type of care. So, you know, as people are looking for solutions to, you know, getting the mental health care they need, EAPs often fall short of this. So that 0 to 0 to 5% really does align with, what Eric pointed out, that overall utilization is usually only like 1 to 3%, just because these services are not designed to meet mental health care as most people need care. It's designed to meet it in a time of crisis. So it's good to see, many different programs changing. That stigma is changing, but we still have a long ways to go in getting other EAP programs up to speed on actually addressing the most common type of mental health care that people find themselves needing access to.
Yeah,
that's a great point.
And if I can riff on that with you, Leah, it's been interesting to see in utilization and uptake data again. I think we've for a long time in HR looked at EAPs as a leading indicator of providing mental health services and relief, and they have been. But as a ratio, there's usually 5 to 10 times as many people getting mental health care through a medical benefit as they are through an EAP. So an EAP is only going to your point, treat a fairly narrow subset of the people that really need mental health care, and with more chronic and persistent issues becoming more acknowledged and the stigma coming down, the incongruity continues to stack up.
Very interesting. Thank you. Eric, in your conversations with employers, how often do you discuss mental health benefits? And what are your go-to resources for employers looking to improve their mental health support to their employees?
Pre-2020, we typically had conversations surrounding mental health, emotional well-being with employers who were either striving to be a best-in-class employer in their industry, or who maybe had experienced an acute traumatic event at the workplace. Post-2020, mental health benefits is part of strategic discussions that we have with almost every employer, regardless of industry, size, et cetera. As Leah had mentioned, there's some industries that definitely are more impacted by burnout, tech, healthcare, et cetera. But we are having these conversations with just about every employer we work with. And in terms of go-to resources, we'll often guide employers in approaching mental/emotional health resources by thinking in 3 separate buckets or categories. The first would be prevention, the second would be protection, and the third, intervention. And there are varying resources you can provide to address kind of each of these buckets. Say the prevention category, think about apps like Calm and Headspace, other resources to help with stress relief, time management, meditation. In the protection bucket, I think this is where employers can make the biggest impact in terms of providing a benefit to employees that they might not access on their own. Providing virtual mental health therapy and counseling resources is an excellent way to address that protection bucket. And lastly, intervention. We talked a little bit about EAPs. There are also some other crisis support resources you can provide employees. But our conversations have really centered around these 3 different areas. And again, that second bucket, protection, is where we have seen the biggest opportunity for employers to support their employees.
Dallin, you mentioned previously TAVA's efforts to improve access to mental health care. Can you elaborate on that, please?
Yeah, I'd love to. Really, our efforts to improve access have started with how we partner with therapists. And similarly, in a COVID-19 or post-COVID-19 world, the options that clinicians have to provide those types of services have just had they've grown exponentially. And so the ways that we partner with therapists have changed over time and evolved and become a little bit unique. But at this point, our relationship with these clinicians truly is a value-add partnership. We give each therapist that is interested in working with TAVA free software. They can use it to handle scheduling or front of desk tasks, or take their clinical notes, or use our video connection to see clients in a HIPAA compliant way. We'll cover the cost of their insurance enrollments. We'll help with their clinical support questions. If they wanted to get a second opinion, they can ask our clinical team. We'll handle all the medical claims for them as they enroll into these different insurance networks. And so we're very involved in helping these therapists run their practices. And in exchange, we get preferred real-time access to their calendars. And that allows us to offer those that sign up with Tava, a much simpler, much more straightforward way of finding a therapist. I know, speaking for myself, years ago when I first started to look for a therapist, even though I thought I was pretty conversant in the world of insurance and human resources, I ended up spending weeks making phone calls and leaving voicemails, being told that I would be put on a wait list that was months long, and being really frustrated with that whole process. And we've streamlined that so that we can get you into care, have you match with a therapist in less than 5 minutes. And then our typical wait time before your care actually can begin and you're able to actually meet with that clinician that you've selected is 2 to 3 days, as opposed to the national average of 2 to 3 months. And then finally, we've talked a little bit about the bifurcation that employers face when they offer an employee assistance program, which offers some types of mental health care, and when they offer a traditional health benefit. And in order to preserve continuity of care, we help kind of blend those two different offerings together so that someone can start seeing a therapist. Maybe it's for short-term care or crisis care, like Leah pointed out, but they decide that they would like to continue meeting with that therapist after they've exhausted a certain number of sessions. And with our platform, they're able to by moving over and continuing with that same clinician, but via the medical benefit that their employer is offering.
That continuity is so important.
Really the access problem, it also needs to be addressed on an employer by employer basis. Not every employer has the ability to offer what can be a quite expensive benefit, even though as we've called out, it's desperately needed. And so some of the ways that we're trying to make the mental health benefit more approachable for employers is by changing the way they pay for it. As opposed to a pure PEPM type model, we've moved to more of a utilization-based model, which parallels the way most self-insured employers are already paying for healthcare. And then we can flex the amounts of utilization that an employer is willing or able to cover out of their EAP portion of their visits versus their traditional medical plan. As I mentioned, we've added our therapists to most of the national insurance carriers at this point. And so they can either offer to cover the first 5 or 6 hours of therapy in traditional EAP style, and then anything beyond the first 5 or 6 hours of therapy would be covered through a health insurance plan. Or depending on the budget and the need of an employer and their population, they might go up to 24 hours of therapy per employee per year. But really providing more flexibility around how employers want to offer that benefit to their team members and meeting them where they're at.
Thank you so much for adding that. Leah, as you have invested in employee mental health in other areas, what specific results have you observed?
Here at Lucid, we've taken a very intentional approach to educate our employees. My personal belief is that the more educated an employee is about all of the various nuances of healthcare in the United States, the more empowered they're going to be in taking control over their health. And mental health is a big part of that. So we've done a huge education campaign for both our employees as well as our managers to really understand the mental health care options that are available through the various benefits that Lucid provides. And, with our Tava benefits specifically, we've seen really incredible utilization. We have, nearly half of our employees that have signed up and registered through the Tava platform, and about a quarter of our employees that are, have had or are currently going through therapy with a Tava provider. So there's definitely a need. We're seeing that utilization come through in our data as well, to make sure that people, first of all, know how to access care, and then are receiving the care in a way that works for them. So that's been really critical for our employees. And then just, anecdotally, we've really leveraged our, mental health benefits specifically to help people overcome a lot of challenges they're having through, interpersonal relationships, anxiety around work or stress. And we've actually been able to, help people use mental health resources in order to avoid performance problems at work, or in order to, handle or help identify ways to handle interpersonal conflict in the workplace. So it's had a direct impact on, a positive employee culture and our employee engagement through the focus on the mental health tools that we've made available through all of those educational campaigns. So overall, utilization is high. We've definitely seen that this tracks from our medical claims data, that this is a need of our employees. We've seen it through the actual mental health specific data that we receive through TAVA, as well as anecdotally coming through in how people interact with each other at our workplace.
Eric or Dallin, do you have any thoughts about the ROI on investing in mental health benefits?
Yeah, I know my background is in statistics and benefits data warehousing, and have seen firsthand that a lot of times mental health, it's tricky to measure because our healthcare system revolves around procedure codes and CPT codes. But the individuals that are challenged with particularly chronic mood disorders like depression or anxiety, their care ends up being substantially more complicated as a result of those specific mental health challenges. Probably analogously to the way that obesity sort of cascades throughout everything else in the system and makes it more complicated and harder to treat. Mental health has similar effects. If you have sought out treatment for a mental health challenge, you're twice as likely to be admitted to the hospital in a given 12-month period. When you are admitted, you end up staying twice as long on average. You are 9 times as likely to go on disability or take a leave of absence. And so if you're looking for a way to measure the ROI of a mental health offering, I would suggest looking at those types of metrics in addition to more of the traditional claims data cuts and employee pulse surveys.
Thank you. I have one more question for you, which is, if you could ensure that our audience comes away with one thing from today's conversation, what would that be?
I'm happy to kick it off here.
Start.
If that works. Very, very simply, there's a high probability that the people that you oversee within your organization are struggling with burnout in its various forms. I think the message that I'd hope to get across is that there is a relationship between employee burnout, resiliency, and interpersonal support, and investments towards creating a culture of meaningful recognition and interpersonal support pay off because they can help address burnout.
Yeah, and to add on to that, being in the HR space, at an employer, I would say that there are things that you can implement, whether that's through your existing benefit package, or if you are able to, and you go through all of the procurement process that it requires, adding additional benefit options. There are things that you can do to address this. I know it can often feel a little bit hopeless to find ways to either get your executive team on board with, implementing change at the company level, or vice versa, like getting employees to actually utilize what's out there already in existence. So really just knowing that there are options, and sometimes it does require creativity, but it's definitely possible out there, even within limited budget constraints, to make changes. It just takes a little bit of doing.
And I would echo the same things. I would hope that if you attend today's webinar, your takeaway is that there are options that are feasible for you to implement, no matter your industry, your employer size, your geography, the demographic makeup of your team. There are increasingly more and more solutions tailored specifically towards mental health. And the ways that you can tweak them and make them fit inside of, again, your own reality, they exist, and they can be successfully deployed.
Great. Well, thank you all. And now we're going to turn to the audience's questions for you. The first one is a two-part question. One, how can we help employees feel seen and supported during these economic times while staying within the budgetary constraints in the current tech environment? Second, is there any HRCI or SHRM approved codes that we can utilize this webinar for recertification credits?
Well, I'm not sure on the HRCI or SHRM credits. Maybe Dallin can speak to that part. But as far as employees being, seen and supported during, these difficult economic times, I think really focusing on a transparency culture is critical. A lot of the times, even when you have to deliver bad news, if you're forthcoming with it and as detailed as you can be, it's received in such a better way by employees. So I think that will help them feel supported, right? If they don't feel that they have no idea what's coming, they're in the dark on everything. If they can have some level of transparency, appropriate for whatever the company's dealing with, really helps in making sure that people feel that they still have some level of control. It removes a lot of that anxiety and uncertainty that causes so many mental health concerns for people just through a more transparent culture.
Any other thoughts, Eric, Dallin? On the second part, we will get back to you on the credits. Okay. What ways can employers bump the use of their EAP?
So this is, and welcome Leah's and Dallin's thoughts as well. This is a tough one, and I think particularly as Leah had highlighted a little bit earlier, EAPs are designed to address a specific type of need, right? And we see that your employees dealing with emotional health challenges often have different types of needs that need to be addressed. So I think it's important to recognize that, right? You're just not going to get 50% utilization of an EAP, right? However, we oftentimes find that employers will advertise and communicate an EAP or an EAP-like resource during open enrollment, and then post-open enrollment doesn't really get communicated. And like with any other benefit, and I do in benefits consulting for a living. Throughout the year, I will forget what my employer offers me in terms of benefits, right? Unless it's frequently communicated. So oftentimes we'll work with employers to develop some type of communication campaign throughout the year, where whether it's through Slack channels or it's direct mail or email, whatever your communication channel might be, trying to keep some of these resources front of mind for employers. So I think communication can definitely help there.
Yeah, I would echo that. Sorry, Dallin. Just that the communication is really the key, and really identifying what resonates for your employees. I mean, it's like a study of what you have to hear something 7 times before it really sinks in. So, in an employee's typical lifespan in your company or your industry, if they're only hearing it at open enrollment once a year, it's definitely probably not going to ever sink in with a lot of your workforce. So finding areas to mention this. We've really kind of looked for some of our champions within the business on a grassroots campaign of where could we plug certain benefits that we offer that don't come across as HR is telling you about this thing that you should take advantage of. Where are some of our other, people within the business that can help encourage others to utilize what's available to them in a way that doesn't feel like they're being just told by, the people operations or the HR team about this. So that's been something that we found a lot of success in to kind of help I don't know, just get the message out there. And the other thing I'd add to that is that in my experience, EAPs have previously been communicated very much on you're dealing with a crisis situation, call the EAP. It hasn't typically been communicated as a longer term solution for ongoing mental health care struggles. And so I think taking an approach where, maybe your EAP is only limited to like 3 or 5 in-person visits with a therapist or counselor per issue per year, that, very typical ways EAPs are structured. To add on to that, the EAP can also help a person find a longer term solution with a clinical provider in their medical insurance network that is accepting new patients. Like, that is something an EAP can help with to really increase, the value behind the EAP, that your employees would actually want to use it rather than just sort of the short-term messaging that is typically associated with an EAP historically.
I would agree with all of those suggestions, and maybe the one other thought would be championing mental health generally is a way to increase utilization of all of your mental health options that your employees have access to, particularly if that champion is a visible leader or an executive, a CEO, a CFO, COO, CXO, someone who's really willing to be vulnerable and willing to talk about mental health and do things as subtle as, again, I'll keep using my dental analogy, but if I were to say, hey, I can't make that appointment on Thursday at 2:00, I have a dentist appointment, being transparent and saying, hey, I'm meeting with my therapist on Thursday at 2:00, or putting that on my calendar and calling it a therapy session, those types of things that normalize mental health access and care are the things that pull stigma down the fastest, culturally speaking.
Great, thank you. Well, continuing on the topic of EAPs, when did you decide you should invest in additional mental health resources for your employees beyond the EAP included in your health plan, Leah?
Oh, yeah. For as long as I've worked with Lucid, which is over 5 years, that's been something that was talked about since the very beginning. However, the start of the pandemic in 2020 definitely shone a light on how urgent the need actually was, as everybody was dealing with so much anxiety and stress given the state of the world. So that really kickstarted our efforts in taking this seriously and doing a lot more of a deep dive analysis, because we knew that there was immediate action needed on our part to provide solutions to keep our employees, working the way that we needed them to work, to keep our business running. So that was really when we sort of took immediate action. But it's been something, I think, Eric kind of alluded to it as well. Previously, it was kind of like best in class employer, or looking to set apart an employer from the rest of the pack in the past. But with COVID, it really became apparent for all sorts of industries, all sorts of employers, that this was a need. So that's when we took action. We started talking with Dallin and his team a lot more, as well as evaluating other providers in the space to figure out what would work best for Lucid employees and our business.
Thank you. I think we have time for one more question. My leadership team is generally dismissive of mental health. How do I convince them that investing in this area is important?
I can chime in on that one too. It really ties back to the first one. I would start with, I think it was Dallin mentioned it as well, trying to show the data, right? What is driving your employee usage of leave policies? Are there, an outsized number of ADA requests that you wouldn't expect given your industry or size of your employer? And what are the reasons behind a lot of those leave requests? Are you seeing any abuse in your sick time policy? Or kind of on the flip side, like, are people not taking advantage of your PTO, which can often be a sign of burnout amongst your employees? So really trying to show that, hey, we have these other things in place, either that we're required to offer through law, like FMLA or ADA or what have you, or through our other internal policies that are not being used in the ways we expected, and connect that to the need for mental health support. So people are having to take time off because they are not getting the mental health care that they need, and it's creating, you know, a much longer time away from work type situation. Or we are seeing in our surveys that people are feeling burnt out, and then we're also seeing that our PTO is not being used to its full capacity, and showing that, you know, a mental health service or a more robust EAP program, such as the one that Tava has created, will help address those gaps, and kind of long-term show that this will have an ROI that your leaders will often resonate with a lot more, and when it comes down to the dollars saved or the productivity or engagement of employees through a mental health service.
Great suggestions. Thank you. Any other thoughts?
No, I think we've hit on this a couple times already. So in addition to the data points that Leah hit on, I think, again, asking a specific question, your next pulse survey or benefit survey, because a lot of times the skeptics can be overcome with the plurality of people that are asking, requesting, demanding better access, better care, simpler access, simpler care.
Okay, that's going to be our last word on the topic. Unfortunately, we are out of time. If we didn't get to your question, Tava will follow up with you offline. Thanks so much for joining us today. And I'd especially like to thank Leah, Eric, and Dallin for being with us and for sharing their expertise. And a special thank you to Tava for sponsoring the event. If you missed any part of our program, you can hear a recorded version within 48 hours on the EBN website, and we'll be sending you an email with a link to that recording. Thanks again for being with us, and have a great rest of your day.